A delayed response, limited testing, and a soft lockdown. Japan has been going against the grain every step of the way in its battle against COVID-19. But with coronavirus cases nearing 20,000, public health experts are asking whether Japan's response and outcome should be called a disaster or a success. Special correspondent Grace Lee reports from Tokyo.
At this hospital just south of Tokyo, a rare sight in the era of COVID-19. A mountain of personal protective equipment. Here, the first wave of the virus has already come and gone. Staff are now preparing for what's expected next, the second wave of infections. Dr. Takayuki Oishi is deputy director of the facility's infection control team.
My impression is that Japan just happened to be lucky. We were in a position where masks were readily available and able to fight the infection that way.
Masks may be the answer to Japan's low death rate, at least according to the government's expert panel on COVID-19. But there are questions as to whether the country took the right steps to battle the virus. There's been no lockdown here due to Japan's strict constitution, only a polite request from the government. Stay indoors if possible and close up shop if you're not essential. That has been the essence of Japan's nationwide state of emergency. It was put in place mid-April, but even that was lifted late last month. Prime Minister Shinzo Abe.
When we declared the state of emergency in Japan, we were not allowed to penalize and force people not to go out. But even so, we were able to conduct the state of emergency in Japan's own way, and we were able to control the spread in just a month and a half.
Experts aren't sure that Japan has controlled the spread, especially because of the country's low test rate. Japan has tested 0.2% of its population, one of the lowest rates among developed countries. There's worry here that the virus may be spreading silently. Japan's rigid infectious disease laws dictate that even mild cases must be hospitalized, and that takes away valuable bed space from critical cases. So authorities here have been reluctant to test people who aren't in critical condition. Instead, they've opted for a different method: track and trace clusters. It's a strategy that experts say worked in the beginning, but has proven difficult in the long term.
Sometimes it's just flooded.
Dr. Masa Numata runs a local clinic in Tokyo. He's been handling a large number of patients with COVID-19 symptoms, and to protect other patients, he's been opening his clinic on his usual days off, strictly for those exhibiting symptoms. He's recommended a handful of them get tested, but none of them has been able to. This is why.
If you get sick, then you have to give a call to certain call center. And then the call center will just contact to distinct outpatient facilities. And then they finally contact to public health center of a local government. But then local government will contact to another institution for the actual testing.
A growing chorus of physicians say Japan's convoluted testing system is putting lives at risk.
That's not right, because some people get serious. And I think only medical doctors can make a decision, and not the bureaucrats.
This COVID-19 survivor went through the system firsthand.
It felt like humans were being just sort of set aside and not cared about.
Drew is a longtime Japan resident who lives on the northern island of Hokkaido. He's asked to stay anonymous due to the stigma surrounding the virus in Japan. After exhibiting symptoms for more than 2 weeks, his doctor recommended he call the hotline and get tested immediately. But he wasn't able to for more than a month.
And they just ran me around in circles and back and forth and back and forth. And finally, at the end of like my 4th or 5th call with them, I just said to her, like, listen, the doctor is saying that I should have a test. You have no medical experience or background or certifications or anything whatsoever. You're just like a trained hotline call answering person reading a script. So like, how can you override the instructions of my doctor?
For Prime Minister Abe's administration, COVID-19 has been a PR disaster.
It seems to us, for a lot of Japanese people, this Abe government is just decide on the spot based on nothing. That was the major problem. I think that people see that and they just keep changing the policies all the time, and they don't have any firm ground where this country should do and then where we should go.
A recent poll showed that 55% of the public is not happy with how Abe handled the outbreak. Most of them felt he was too late in declaring the state of emergency.
The root problem is that they don't have good statistics in terms of the number of cases of COVID-19 because we are so behind in testing.
International criticism began in late February with the government's response to the Diamond Princess. More than 700 people were infected on board the quarantined ship. Criticism toward the Japanese government intensified later over another hot-button issue in the global spotlight, the Olympics. Abe was accused of downplaying the severity of the pandemic in an ultimately unsuccessful attempt to keep the Games on for this summer. Now, as restrictions are relaxed across the board, residents here are left feeling uneasy. Many don't trust the official figures.
I'm afraid we might see a second or third wave of infections. I have children and they're currently not going to classes, but if they have to start going on the subway to commute, I'm worried they might catch the virus there.
Doctors say Japan isn't quite out of the woods yet and are urging the government to ramp up testing. Medical staff are hoping if there is a next wave of COVID-19, it won't overwhelm the system. For the PBS NewsHour, I'm Grace Lee in Tokyo.